A major illness can frequently strike suddenly and without any prior warning. The difference between life and death may lie in knowing what to look for and identifying the warning signs early on. This post is not meant to alarm you or cause you to worry about minor health problems. Its sole purpose is to educate you about the signs of a potentially dangerous sickness so you can recognize them as soon as possible. Now let's get started. 1. Chest pain. There are several possible causes of chest discomfort, ranging from a heart attack to muscle soreness. It's important to keep an eye on both the intensity and onset time of the discomfort. If the pain is sudden and severe, seek medical attention right once. No matter how severe, persistent discomfort may be a sign of heart disease. It is not advisable to ignore chest pain till it subsides. See a physician if it lasts longer than a few days. 2. Abdominal pain. Stomach pain is complex and can have many different causes, much like chest discomfort. It may mean something as unimportant as a stomachache brought on by a certain food. On the other hand, chronic stomach pain could be a sign of a far more dangerous illness, such cancer or gastrointestinal disorders. Take into account the length and severity of your stomachache and modify your answer accordingly. Recognize that stomach issues can occasionally coexist with abdominal pain, so use caution there as well. 3. Sudden weight loss or gain. Most of the time, a sudden, unexplained change in weight has serious health hazards. It may be a sign of several dangerous conditions, such as heart failure, diabetes, and thyroid problems. A significant decrease in weight is another sign of most malignancies. However, in cancer patients, this symptom is typically combined with multiple others. Generally speaking, if your weight changes suddenly, get medical advice. 4. Changes in appetite. Abrupt changes in hunger are also cause for concern, as they are closely linked to variations in body weight. The body's rate of food digestion normally affects hunger, and any noticeable shift in this is usually an indication that something isn't quite right. Remember that if, for a day or two, you find yourself experiencing unusual levels of hunger or fullness, there's nothing to be concerned about. The problems stem from long-term variations in hunger that have an immediate effect on fluctuations in weight. 5. Fatigue or weakness. Feeling tired or exhausted can be caused by a multitude of factors. Mild types of exhaustion can be caused by anything as benign as not getting enough sleep or rest. Fatigue resulting from sleep deprivation usually subsides quickly as long as the sleep routine returns to normal. If you are so exhausted that you cannot get any more rest, you may have a major medical condition such as diabetes, sleep apnea, or heart disease. 6. Shortness of breath. This is unrelated to dyspepsia brought on by physical activity. Instead, this is a reference to fast, shallow breathing, which may be a sign of lung or heart problems. The cause of the dyspepsia may be indicated by how quickly it occurs. For instance, if breathlessness occurs quickly, it may indicate pulmonary embolism, a blood clot in the lung, asthma, or low blood pressure. Prolonged dyspnea may be a sign of chronic obstructive pulmonary disease, COPD, pulmonary edema, or other lung disorders. 7. Nausea or vomiting. No, you shouldn't freak out every time you feel a bit queasy or have a stomach bug. Just be concerned if the nausea or vomiting lasts for a long time, as is the case with the majority of these warning indicators of a serious sickness. There are various gastrointestinal disorders that may be the cause. Once more, if these symptoms disappear after a day or two, don't panic. Nausea and vomiting can be brought on by a variety of conditions, including food poisoning and the flu. 8. Difficulty swallowing. An injury to the throat is the most frequent cause of swallowing difficulties. Cancer is the most severe form of this damage. However, it can manifest in many other ways as well. You don't always need to watch out for this specific warning sign because it often coexists with other symptoms. 9. Ankle or leg swelling. Ankle or leg edema is frequently brought on by an injury of some kind. If the swelling, however, cannot be directly linked to an injury, it can indicate a more serious condition. For instance, leg swelling may indicate inadequate circulation or a leg infection. It could also be an indication of liver, renal, or cardiac failure. Swelling is a result of the body producing an excessive amount of fluid in all three of these illnesses. If you already have one of these conditions and the swelling worsens, give your doctor a call. It can be an indication of problems. 10. Skin discoloration. A study by a group of dermatologists suggests that in some cases, the skin might truly reflect inside bodily processes. For instance, variations in skin tone may indicate an underlying illness. In the most well-known case, skin discoloration may indicate liver illness. 11. Unexplained rash or growth on skin. Unusual skin rashes might sometimes be an indication of an infection or other inside problem. For example, an allergy to a new medication may result in a rash on the affected person. If, soon after starting a new drug, you experience an inexplicable rash, be careful to speak with your chemist. Seek medical assistance if the rash is accompanied by other symptoms, such as fever or pains.